So this video is to help you understand what a course of ketamine treatment looks like and what to expect when you come in, sort of more the logistics of how ketamine infusions work. So our schedule of ketamine infusions is that we do 8 infusions over the course of 8 weeks. And what that looks like is we do 2 infusions on the first week, we do 2 infusions on the second week, and then we do 1 on week 3, 1 on week 4, 1 on week 6, and then 1 on week 8. And that allows us to start to space out over time, and it helps us understand what your maintenance plan will look like moving forward. A lot of patients do have some sort of maintenance to continue to continue the effects of the ketamine, and so we will start to space out over time so that we can get a sense of how you respond to both ketamine in the clinic and then also spacing out. And we may consider adding at-home options such as like ketamine troches, which can help you maintain the effects. When you come into the clinic, the total time here in the office for an infusion is about 2 hours. And that entails about 20 to 30 minutes of time for us to get you set up on a monitor. We'll put in an IV. We'll put you on a telemetry monitor so we can measure your heart rate. We'll put you on a pulse ox so we can measure your oxygen levels, and then a blood pressure cuff to monitor your blood pressure throughout the infusion. And also during that time, we'll start to talk about what is your intention going to be for that session. And so we'll help you get into the right mindset and help you focus your time here in the clinic so that you can get the most out of the infusion. That also helps us decide on how we select your music. So we use a special music program that will help enhance the effect of the ketamine and really help guide you to what you wanted out of the infusion for that day. The infusions themselves last 40 minutes. And then after that, there's about 20 to 30 minutes of time where you're recovering and you're starting to come back to normal consciousness and starting to, get up and walk around and start to come back to, regular consciousness. During that time, we'll come in and start talking to you about what came up during your infusion and help you process and break down, what these things could mean and what things came up and how to interpret those in terms of the grand scheme of your life and your goals. We do require that somebody drive you to and from the appointments, even though you're kind of up and walking around after 20 to 30 minutes after a ketamine infusion. Your coordination and reaction times and things like that can be impaired for several hours after an infusion. So you would need somebody to drive you to and from the appointments.